Hello and welcome to this MIMHtraining.com presentation, Teen Screen Schools and Communities, bringing evidence-based screening to your community. My name's Tom Pansella with the Missouri Institute of Mental Health. Thanks for taking the time to take this training program. We are joined today by Deanna Richards, and Deanna serves as the Program Manager for the Teen Screen Schools and Communities Program, which is the flagship program of the Teen Screen National Center for Mental Health Checkups at Columbia University. The National Center operates over 1,500 sites in school, community, and primary care settings. Additionally, she's worked with youth in various capacities since 1999. She's worked for the New York City Department of Education as an educator and has been involved in the creation of a new New York City high school. She's also worked with adults at the Eastside Institute, an international research, education, and training center for human development and community. Deanna is currently pursuing an educational master's in psychological counseling at Columbia University. Deanna, thanks for joining us.
Thank you for having me.
Why do we need Teen Screen?
Well, I think the greater question is, why do we need mental health screening? And Teen Screen serves as a program to address the need of mental health screening. As we know, suicide rates have decreased in the past couple of years, but it remains the third leading cause of death for youth ages 18 through 25. So in addressing suicide, we also need to be addressing how can we better locate, identify, and help connect those that need care with treatment in their community, and Teen Screen does just that.
Go ahead.
Sure. So Teen Screen works by partnering with schools and communities. Currently we have over 600 sites, individual community and school sites that do screening in their communities, and we work by involving mental health professionals in the communities, school social workers, school counselors. We get the support of teachers and school administrators, parents, families, and friends. And together they form the Teen Screen local program. And these programs work by utilizing screening tools developed by Columbia researchers that will identify teens that are suffering from depression or other mental health illnesses or disorders. We then work with the community providers to link the families and students with care. And then we do follow-up. Case management is actually a part of the Teen Screen program to make sure that they've attended an appointment and to see how it's going and follow up with them.
Tell me about the linking process. How are you getting all of these disparate people together?
Well, really all of that work goes through the community organizers of the local Teen Screen program. As program manager, what I do is I help facilitate the development and implementation of the program. I help them locate resources in their community, give them ideas about how to make the connections, how to come up with money to run the program, and different ways to engage the parents in the community. But really, the brains behind the program comes from the community. It's homegrown because we don't know that community's needs. They know their students, they know their families, they know what they can offer. And so we really work with them to help them identify people resources and mental health resources in the community.
And what kinds of funding streams are people pursuing?
A lot of our programs are funded through the Safe Schools and Healthy Students Grant, Community Transformation Grants, CDC gives money, SAMHSA gives money, and some are funded by private donors, families that have experienced a suicide or experienced mental illness and want to give back to the community.
So you mentioned that the model is geared towards a lot of different kinds of folks. Who do you target specifically when you're going out into the outreach efforts?
That's interesting. A lot of times people come to us, and again, it's because they've experienced mental illness or suicide in their family, their school, or their community. And so in a response to the suicide, they're looking at different ways to, one, offer support as the community tries to deal with this tragedy, and two, prevent it from happening again. So many times school social workers, parents, even teens will call in and say, what can we do about this problem? Help. And so that's where Teen Screen can provide our guidance in developing the program and helping them implement the program and garner community support around this. When we do outreach, we do tend to look at school districts where we see suicide clusters, Schenectady comes to mind. They had a suicide cluster a few years back, and the community was galvanized to do something about it, and Teen Screen was certainly there to help them develop and implement their program.
So give us some of the nuts and bolts then. I'd like to take this from a couple of different angles, but let's start with what the example that you just did. You talked about a school district having and identifying a cluster. What was some of the process that you went through then?
Well, their process was a little bit different. It was very involved. We had a few Columbia researchers go out there and give presentations to the community, give presentations to some of the mental health providers in that area. We also had our own office did outreach to them, so we provided them with all the development materials, and then we kind of fast forwarded them through the process. So again, Teen Screen doesn't just focus on screening teens, but it also really focuses on making sure that the families are able to get the treatment that they need for their teen. So in that vein, by us fast forwarding them, we were able to connect them, help them kind of re-envision and reframe the types of resources that they had in their community, help them form partnerships with some of the bigger agencies and hospitals there so that they could implement and act upon crisis plans, and essentially really help them build their program more hands-on than we normally do. Again, we don't like to get too involved. We want it to be a community-grown effort because they know what's going on. They know what's going to speak to the schools and to the families in that area.
And what kinds of resources then do you kind of help people gear towards? What do you help them to look for?
Sure. So we have a development guide. We've just revamped it. It's on our website, so now anyone can go on and download it and get started on developing their program. And that really runs through the nuts and bolts of what you need to develop the program. So we cover grant writing. A lot of communities don't have the money to implement a program. Our program is actually free. I should have mentioned that from the start. All of our training and our support, ongoing support, is free. The screening questionnaires are free. However, communities still need to budget depending on how large their screening program is going to be and what it's going to involve. But we run them through a grant writing piece within the development guide. We cover how to identify resources in the community, and we provide sample letters so that they can use that and reach out to the members in their community. We provide parent consent letters, FAQs for school administrators and for families. We've also been producing a number of individualized sheets so people can download templates from our website. For instance, one that we recently developed is a multiculturalism in your community website to figure out who are you going to attempt to serve and what types of multicultural considerations do you need to have in place in order for your Teen Screen program to be effective there. And the program itself has been proven to be effective in all different zones and with all different races. We just had a research report that was put out by Fond du Lac, which shows that Teen Screen works very well in identifying and linking families to mental health resources, and this was done in a more affluent, mostly white population in Fond du Lac, Wisconsin. And we also had a research report come out recently that looked at Teen Screen's effectiveness with African American youth in an urban population, and the results from that were excellent. So again, we have evidence that it works. We have evidence that it works for teens from any background, from any SES class, but it's really up to the community to start to pull the pieces together and figure out what's going to work best based on where they plan to screen. And so we've developed some tools to make that process a little bit easier. We also develop tools that help people give a presentation about Teen Screens. How do you promote mental health in a community that's either afraid to talk about it or doesn't understand the need for it? So through our website, people can get state statistics on suicide. They can also find out if there are Teen Screen sites in their state so that we can contact them and put them in touch. And they can hear some anecdotes from people who are running it, and they can also hear from teens and families who have gone through the program and feel like it saved their teen's life.
And so when you talk about going through the program, then what are you taking a teen through?
So for a teen, the process would involve well, first they'd have to get parent consent. That's a big one. Teen Screen is not allowed to screen teens without the parent's consent. And this is important for a number of reasons, not just because it's important for the parent to know and to give consent, but when you're looking at connecting a teen to the resources, you're going to need your mom or your dad to drive you there. You're going to need their support. You're going to need somebody at home to check up on you and say, how did it go today? So it's really important to get parents active in that process from the start. So all Teen Screen programs utilize active parent consent. They must sign off on it. And then we have the teen assent to the program. So the teen gets a full understanding of what they're going to experience, what it means for them when their screen is either negative or positive, and what happens next, what happens after that. And many of our programs also implement kind of a debriefing strategy that involves linking the teen to resources in case something happens in the future. You're fine now, but in case you feel blue later, in case you have some of these feelings of hopelessness, in case you have a friend and something comes up for you, here's where you can go, here's who you can talk to. So our teens get the parent consent, they then assent to be screened, they take the screen. It takes about 10 to 15 minutes of their day. Usually if it's done in a school, they're released from class, health class typically. They wait there while their screens are scored by professional screening staff. And if it turns out that they're negative, meaning that there's no concern, they still have a chance to speak with somebody. So they can ask a question, or they can say, you know, I didn't ever say this, but I don't understand something. I have a question about something. Sometimes this comes up, and that wasn't addressed on the screen, whatever it is. And there have been a lot of issues that have come out in that debriefing. Find out about teens who are homeless, finding out abuse in the home. Sometimes it's as small as finding out that a teen needs to go in and get their eyes checked. So that really creates a one-on-one. They feel like they get to speak about things and they have a chance to be further evaluated if something comes up in that interview. If a screen is positive, meaning that the teen did say, yes, they've been having suicidal ideation, or there have been suicide attempts, or there's some other implication that there might be depression or another mental illness, they have a 20 to 30 minute triage evaluation by a licensed clinician. And in that, the clinician goes through the screen with the teen is able to explain their answers, to ask questions again, and that clinician decides whether that teen should go on for further referral. And at that point, the teen is informed that their parents will be notified by a case manager, part of the screening team, and the case manager will, with the teen present sometimes, connect with the family and start to figure out what resources in the area would be best for that teen based on their screen. And then there's follow-up involved. So that's pretty much the process for teens. Again, some teens have a quick 5-minute check-in, and some teens have a longer evaluation, but since every teen gets to speak with somebody, it really also decreases the stigma. Every teen has gotten to speak with somebody, so no teen is identified as you're positive or you have a problem, you don't.
I'm going to talk about stigma a little bit. I mean, you talk about it decreasing the stigma, but I mean, there are still barriers around stigma in the mental health treatment field. What else do you do to address some of that?
Well, Teen Screen currently does not offer a whole lot in terms of psychoeducation. However, our program is flexible enough where if a school district wants to implement psychoeducation either within the health curriculum or as an addendum to their curriculum, they can do so. And I'm thinking of a fantastic site that we have. They're located in Ohio. And they work with each school and they figure out when they want to do the screen, for how long they want to provide psychoeducational materials, and what's going to be best for that school population. And I had the pleasure of visiting them in Ohio, and they put together a Jeopardy game. And so for 2 to 3 weeks of the health curriculum, they focus on different mental health issues, they focus on depression and other signs of suicide. And then they do this whole Jeopardy game where the kids are engaged and they're getting points 200 and they're able to really kind of in a fun manner learn more about the signs of suicide, symptoms of depression, and other mental illnesses. And at the end of that, they've received so much education about mental health that they're eager to run home and take the consent form to their parent. Their parent's aware of what's been going on because they've been communicating with the school and seeing assignments. They sign the consent form, the teens sign the assent form, and then they complete the screen at the end of that psychoeducational piece. And so that's one of the ways that Teen Screen is flexible enough where it can be used in that way, or it can be used as part of Postvention, where there is a suicide. There's no real time to put a lot of psychoeducational pieces into play, but they want to address and assess the teens in the school and provide some kind of support. Teen Screen works in that way as well.
Sounds like a good model. A lot of the audience for a program like this would be frontline mental health professionals.
Yes.
The social workers, case managers, counselors, those types of folks. What would be your message to that community, to that group of folks?
Well, I'm studying to be a mental health counselor, and I certainly know what it means to be on the front line. I was a New York City public school teacher for many years, and what I would say is that all that we think we know, we don't know. And as many kids as we're able to identify in a class, there's that many kids that we miss. And Teen Screen is really a safety net, if you will, a catch for the teens that are suffering so silently that we're not able to easily identify them. And school counselors and school psychologists do a fantastic job. They really, they know the kids, they know the families, and they are an integral part of the program, which is why a lot of them end up doing this. But even they know that sometimes it's the jock who was doing well, was getting A's in every class, was popular with everyone, he commits suicide, and the entire school community is aghast, thinking, how could this have happened? We didn't catch it. And so Teen Screen serves to catch those teens, to really uncover silent sufferers.
What do you tell a school that's gone through it and lost a kid anyway?
Well, it's interesting you mentioned that. In September, we will be hosting a webinar about Teen Screen and its use in Postvention. And we have had schools that are using Teen Screen and have the community in school has experienced a suicide. And from what they have reported to me and to the Teen Screen community is that having this program in place enables them to support in ways that they would not have been able to support had they not had this in place. So with Teen Screen as part of their crisis plan, they're able to better support the families and the teens. So one, they're able to catch teens who may be experiencing increased levels of distress because of the trauma that they've just experienced with the school. And this helps control suicide contagion. This helps control the suicide cluster. And two, the family and the students and the school feel supported that they already have a system in place so that they're not scrambling around after this has happened to both deal with the loss and deal with the after effects, the mental after effects, the distress that causes. So they're able to provide more emotional support, to figure out what to do next, to figure out how to honor the student, and they don't necessarily have to worry about, well, what do we do now about, so this doesn't happen again. They've already got it in place.
I think we've got something like 500 school districts in the state of Missouri, and it's been our experience that it's been very difficult to break into the curriculum because it's a very packed curriculum. We've tried to do addictions education and things like that within the school settings. How do you get in?
Well, I think as I mentioned before, a lot of times they come to us, and so they're already opening the door and inviting us in. And sometimes we knock gently and say, hey, this is important and here's why. And sometimes we knock a little louder. when a school district has already experienced suicides. But getting in really involves establishing a sense of trust, which is difficult to do, especially within the school system. They're so individualized, and having worked in schools, I can definitely understand how hard it is to get people to do something new, and to ask people to add something to their plate when there's maybe not enough money and certainly not enough time. But I think that with some of the new initiatives that have been going on with school, and by this I'm really referencing response to intervention and positive behavioral intervention supports, these messages are really driving home the need to address academic achievement as well as the emotional and social and mental well-being of the students. And so even within those two models, they have a pyramid of here's what we do for academic, and we tier them, and here's what we do when we notice a kid is having a problem, we tier them. And they're finding, oh, we don't really know what to do about teens that we've identified as having a problem. And Teen Screen offers a solution to that. And so by working with schools, school districts, and individual schools who have really taken a hold of that model and have really embraced the concept of the whole child, we're finding that more and more people are opening their doors.
And then what about the pediatrician community? How do you work with them?
Well, we have a primary care program as well, and I'll only speak briefly about it because there are those that know much more than I. But essentially, we have been working with larger organizations like Emblem Health, and we have a large base in Denver, Colorado. And we utilize very short pamphlet screens that have been evidence tested and proved by the AAP and by other leading organizations in pediatric health. And really, again, driving home the message that you have to address the whole child. So when you're taking your child in for their annual physical checkup, you also need to be taking your child in for their annual mental health checkup. And so these, we use the Pediatric Symptoms Checklist 9 and the Pediatric Symptoms Checklist Modified, and they're able to take it in the waiting room. The pediatrician would then score it and then refer out. So the pediatric community has really taken a step forward in making recommendations for, calling for mental health checkups to be done, and so they're providing funds for doctors to do this, and so more and more doctors are picking up on this, and so we're infiltrating both. I shouldn't have said infiltrating. We're in both primary care settings and school and community settings, and we also do a lot of work on the Hill and working within policy to see that change. So Teen Screen National Center as a whole is really tackling the issue from all angles.
Who can contact Teen Screen?
Anyone can contact Teen Screen. Anyone who's interested in learning more about the Teen Screen program. Currently, we do not provide direct services, so if you're a teen in crisis, you certainly should call 911 or call a suicide crisis hotline. If you are a parent who's concerned about your teen, you should definitely talk to your primary care physician and look at resources and mental health resources in your community. But if you are a school administrator, if you are a teacher, if you are a social worker, if you are a mental health counselor, marriage and family therapist, school psychologist, superintendent, if you are a caring community member, then you should definitely feel free to call or to visit our website. There's a wealth of material there. And again, our development materials are free of charge and they're available to download. And our training materials are also free of charge, and all you need to do is sign up and start your training.
Do you work with the faith communities too?
Faith communities?
Mm-hmm.
We do some work with them. With Catholic schools, our program has been used, Boys Town, but we don't specifically target faith communities. However, since the program is pretty flexible, we found that in communities where faith is kind of the galvanizing force of the community, that's where they go to give their presentations. that's where they go to meet the parents. When you can't get the parent coming to the school for PTA, they're going to the church to meet the parents. And that's one of the things we say about when you go to engage parents, you have to go to where they are. So if that means going to the Women's Book Club, that's where you go.
Let me give you one last chance to plug the website and tell people a little bit about it.
Sure. So if you're interested in Teen Screen, in the National Center and the work that we do in primary care settings, in school and community settings, or if you're just interested in policy and interested in being an advocate, please go to our website at www.teenscreen.org, or you can contact me, Deanna Richards, at 212-265-4427.
Well, we certainly appreciate your time and your expertise. And folks, we thank you for joining us on this program.